Welcome to this explainer. Did you know there are nearly 74,000 licensed nurses in the state of Kansas? It's a literally massive, incredible workforce. But every single day, dedicated professionals in that group face totally unnecessary stress and career interruptions. Why? Just because of one little administrative oversight, letting their license expire. Look, whether you're a seasoned professional who's been at the bedside for decades, or a complete beginner approaching your very first renewal, navigating all that paperwork can sometimes feel, well, a bit overwhelming. But it doesn't have to be. Today, we're providing the ultimate roadmap to mastering the Kansas Board of Nursing renewal process. We're going to completely demystify the rules, the requirements, and the systems you actually need to know.
To get us started, I want to pose a pretty high-stakes question to you. What exactly happens the day after your license expires? You might be thinking, well, it's just a clerical delay, right? I'll just get to it this weekend. But the reality of missing a deadline in Kansas is incredibly strict. It happens immediately.
So the crucial point is, Kansas offers exactly 0 days of grace period for late renewals. Absolutely none. If your application is even one single day late, your active status is completely gone. You can't legally practice, you cannot provide patient care, and you immediately transition from a simple, easy renewal process into a much more complicated reinstatement process.
To make sure you never hit that 0-day wall, here is our agenda for today. First, why renewal matters now. Second, eligibility and CEU requirements. Third, the step-by-step renewal process. Fourth, managing lapsed license issues. And finally, some pro tips for success.
Okay, let's jump straight into Section 1, Why Renewal Matters Now, the high stakes of keeping your status active.
We all know how incredibly busy nursing is, right? You work in long shifts, you're caring for patients, charting, managing 100 things at once. But this one administrative task literally cannot slip through the cracks. Think about an active license versus an inactive or lapsed one. With an active license, you've got the legal right to practice, provide patient care, and obviously maintain your employment. But the moment that license lapses, it's a career-halting reality. Practicing with an expired license is considered illegal in Kansas. If you're discovered, it can lead to immediate termination by your employer, mandatory reporting, and severe disciplinary actions from the Kansas State Board of Nursing. We're talking fines or even permanent revocation. It is an easily preventable situation, but it carries massive consequences.
Let's dive into Section 2, Eligibility and CEU Requirements. Basically, earning your continuing nursing education hours.
Before you even think about touching that renewal portal or paying a fee, you have to meet the state's specific educational criteria. Kansas requires you to prove that you've been keeping your skills and knowledge up to date. For the vast majority of renewals, you're going to need exactly 30 contact hours of approved continuing nursing education, or CNE. This is a non-negotiable requirement for RNs, LPNs, and APRNs during each 2-year licensing period, and you have to complete these hours before you hit submit on your renewal application.
Now, here is a slightly quirky, very specific Kansas rule that honestly catches a lot of nurses off guard. In Kansas, a contact hour is defined as exactly 50 minutes of approved educational learning time, not a full 60 minutes, just 50. Furthermore, Kansas accepts fractions of hours, as long as they are over 30 minutes. It's a small detail, sure, but knowing this ensures you're calculating your completed education time accurately.
Let's break down the nuances between the different license types. RNs and LPNs need 30 contact hours of general approved nursing topics. If you're an APRN, you also need 30 contact hours, but there's a strict rule here. Those hours absolutely must relate specifically to your advanced practice role. Now, what about the first renewal exemption? This is awesome. If this is your very first renewal and your license expires within 30 months following your initial licensure exam, you are completely exempt from the 30-hour requirement for this cycle. That exact same rule applies if you're renewing within the first 9 months following a license reinstatement or an endorsement.
Moving right along to Section 3, the step-by-step renewal process. Let's navigate the KSBN online portal together.
Once your 30 hours are safely in the bank, it's time to hit the online platform. The digital roadmap is actually super straightforward if you know what to expect. Here are the 4 actionable steps. Step 1. Log in to the KSBN portal. Step 2. Update your personal info, like your physical address and email, and formally attest to completing your 30 CNE hours. Now, you might think you need to upload your certificates right then. Actually, scratch that. You don't. You just have to have them ready just in case you're audited. Step 3. Carefully answer all the legal disclosures about any misdemeanor or felony convictions or disciplinary actions. And finally, Step 4. Submit your application and pay that renewal fee.
Let's talk finances real quick. For a biannual renewal, RNs and LPNs pay $85, while APRNs pay $55. Now, it is incredibly vital to note that the Kansas State Board of Nursing is a fee-funded agency. By law, they cannot issue refunds, none at all. So you definitely want to double-check your application before hitting that submit button because those payments are strictly non-refundable.
Now, what's really interesting about this next part is how easily avoidable these common platform errors are. First off, after you submit, give the system about 7 to 10 business days to process. Do not log back in and submit a duplicate application just because you don't see it updated immediately. You will be charged twice, and remember what we just said, no refunds. Also, if you happen to be an APRN with a Kansas RN license, you have to renew both licenses. Make sure you put both the RN and the APRN licenses in your digital shopping cart before you check out.
So what happens if things go wrong? Section 4, Managing Lapsed License Issues. What to actually do if you missed the deadline.
Look, life gets in the way sometimes. If you miss the deadline, you're officially in reinstatement territory. You can't just log in and casually click Renew. Here is the mandatory protocol for fixing a lapse. First and foremost, you must stop practicing immediately. Continuing to work is illegal. Next, you have to submit a formal reinstatement application through the portal. The financial penalty hits you here too. The fee jumps up to $150 for RNs and LPNs. Finally, unlike a standard renewal where you just check a box to attest to your CEUs, a reinstatement requires you to provide official, physical proof of your 30 contact hours. And you absolutely cannot return to work until the board officially approves this reinstatement.
I also want to give a brief warning for anyone who might be stepping away from the profession for an extended amount of time. If your license has been lapsed for 5 or more years, Kansas requires some heavy, time-intensive proof of clinical competence. You'll literally be mandated to successfully complete a board-approved refresher course and pass a full background check with fingerprints before you can even apply to be reinstated.
Let's get proactive. Section 5, Pro Tips for Success. Staying organized for years to come.
Our entire goal here is empowerment. We want to give you proactive strategies so this administrative process never has to be a source of stress again. So, here's your ultimate organization checklist. First up, know your cycle. Kansas operates on an odd/even birth year system. Born in an even year, you renew in even years. Odd year, odd years. Simple as that. Second, remember that your license always expires on the last day of your birth month. Third, utilize CE Broker. Kansas officially integrates with this platform, which makes tracking those 50-minute contact hours an absolute breeze. Finally, set a calendar reminder 60 days out. Now, the board will actually send you a yellow postcard and a digital reminder 60 days prior to your expiration, but setting your own alert ensures you never miss a beat.
Before we wrap things up today, we just need to provide this essential disclaimer. This explainer is for general informational purposes only. Rules and fees can and do change, so always consult the official Kansas Board of Nursing website or a legal professional to verify the requirements based on your unique circumstances.
Well, we've covered the stakes, the rules, the portal, and the pitfalls. So I'm going to leave you with this final, provocative question. Are your 30 hours ready for your birth month? Seriously, do not wait until the grace period that doesn't even exist. Check your CEU progress today, mark your calendar, and secure your incredible nursing career. Thank you so much for joining us on this explainer, and we will see you next time.